Hi, Christian. Welcome to the panel for Disrupt Health. Thank you for being here late at night or in your day. You're from the Nordic AI Institute. Please tell me a bit more about yourself and your interest areas in healthcare.
Mm. Yes, so hello to everyone. Thanks, Gora, for having me in the interview. So in short, I guess you can, look at three areas of my AI experience. So first, I've been working in it for perhaps 25 years, very passionately. One area is scientific, so I did a PhD. I'm also adjunct associate professor at UNSW in the Karolinska Institute, so that is something I've been doing for a long time. I worked in and created startups in the area of artificial intelligence and health in particular. I work for large corporations and work for them still. So one example is now that I'm the global head of artificial intelligence and vice president at Tieto, which is a Finnish-Swedish company, and they are very active in this field. And then the focus areas, yes, so I would say the last 15 years, 10 years, I worked a lot in artificial intelligence and health. And that includes multi-agent systems being used in primary healthcare. It includes natural language processing that has been used in the area of healthcare, but also other areas that I'm very interested in, including finance, banking, forestry, retail. And so these are other areas which often, in fact, overlap with healthcare too.
Can you tell me some examples of using AI in healthcare? What are the design challenges of personalizing the AI to the patient and then to the disease?
Mm. Yeah, so some examples in the area of AIs, for example, radiology. I think many of us know examples where you have an X-ray or you have MRIs, and you start understanding patterns, unusual patterns and abnormalities in these types of scans. And that is something where we have a lot to gain from, because you have an enormous amount of data, and AI is particularly good in understanding abnormalities in sort of these supervised learning sets. So that's one area. And design challenges in those areas are often not so much to do with the data access, but also with integrating it into practice and making it part of a doctoral and a clinical setting. And another example is perhaps predictive analytics or predictions of multiple comorbidities. So we're working actually at the Karolinska. There's a research project where a PhD student of mine and a group of researchers is working on predicting outcomes and resource use in a clinical setting for patients that have several diseases, like, for example, heart disease, nephrology, nephritis, and diabetes. And when these all three come together, you start having quite a different setup, trying to predict how conditions develop for these types of patients. And there, actually, the design challenges is we have a very close collaboration between the healthcare experts and the AI experts in these.
Great. So I see that there's always the challenge of the data, and the more data you have, the more powerful the AI. With a patient with comorbidities, does it sound reasonable for them to have different AIs, or do you see a future where there's a companion AI, where it's a single channel, but different AI frameworks and are modular enough to fit into them? Is this happening?
Yeah. Yeah, absolutely. I think that's where the trend is going. Starting to see many different so-called narrow artificial intelligence components that focus on individual, services and products, and start combining them and enhancing them with other narrow AI, so that you actually start having a more complete system. And I think some are familiar with the term general intelligence, for example, and I think these will be the breakthroughs once you start really combining two or three completely different fields and applications for patients, and then naturally you start being able to speak to the patient through one channel. So there you would perhaps you would have a robot, and you have a speech recognition system, you have a natural language system, and also sensors that would be able to understand where the patient would be heading in their disease state. And this is in part already experimented on in Japan, Asia, in some places in California. So I think, yes, there will be breakthroughs in these areas in the next few years.
Definitely, integration is a challenge, but also will be very fruitful. Another problem for AI is to have context and memory, so that the relationship between the AI and the person is able to retain some of the state, the emotional, behavioral, and health state of the person. I believe it's really important for engagement to improve trust and adherence. Can you comment on this?
Yeah, absolutely. I agree. I think it's very important. The relationship to, to other entities, robots, other human beings is very critical in a healthcare setting. And in fact, I worked on this many years ago in my psychology thesis on improving trust in these natural language processing chatbots, you would call them perhaps today, and trying to make those bots interact in a way where they deliberately improve trust. So that is certainly one very interesting area. And I think that there's more to come. There's a lot of research on that topic, and essentially also make these AIs more approachable, and therefore also much more active. So an example here is actually a robotics application for kids that have diabetes between 6 and 12, and they are actually taught and they interact with the robot in a way where they can learn very easily how to deal with their diabetes type 1. And that's an important way how to relate. And it's actually quite good. And kids are somewhat more open to these types of practices.
Okay. Very interesting area, I'm sure. So in the movie Her, I guess, which I've spoken about, this man falls in love with an AI operating system. I believe that addiction's beginning to happen in many places, in many different age groups, not just the young. Um, how far are we from seeing this in terms of the semantic ability of an AI to understand the context and be able to relate to that context in a real human way?
Mm-hmm. Yeah. I think there are certainly some steps that have been taken already, and I think it is worth to name a book, the relationships that are forming between, let's say, creative entities and us as human beings. That's actually not a new phenomenon. There's a very good book that is based on research from the US, and I recommend that. It's called The Media Equation, and it discusses in detail how people are relating, for example, to characters in their favorite movies or soap series, and the effects, the emotions that we show to those, let's say, created entities, actors, are actually extremely similar, the same than what we would exhibit when we are interacting with other human beings. And this has actually been transferred about 15 years ago into artificial agents, into AIs, so that they also become more believable and we can have a relationship with them. So this is certainly underway and has been underway for perhaps 30, 40 years. And then there's also effects where you can do it perhaps a little bit too much. So there is a time where things look cute, things look realistic, and then they look too realistic, and then they're actually looking a little odd. And I think some of us have examples in our mind.
So
perhaps
maybe even inserting some level of human error into an AI to make it more realistic, to make it more believable.
Yeah.
Okay.
Yeah.